So for this video, I'll be palpating the quadrants of the abdominal region and the structures inside. So in the right upper quadrant, we have the liver, the right kidney, which we palpated more on the posterior aspect. You also have your colon and your pancreas. Going to the right lower quadrant, you have your appendix and your colon and small intestines. Going to the left upper quadrant, you have your stomach, the left kidney as well, the spleen, and the colon and the pancreas. And for the lower left quadrant, you have the colon and the small intestine. So this next test is going to be the beaver sign. I'm going to have my patient supine, and I'm going to have you bend your knees up and like you go into a sit-up position. So I'm going to instruct the patient to slowly go into a sit-up position. We go halfway, and you're looking to see if the umbilicus moves. So if I could have you come halfway up. So you see that the umbilicus does not change directions, forward, lateral, or downwards. And a positive indication, if it did move, would indicate that there is nerve innervations to the muscles that are abnormally working. So now I will be assessing my patient's vitals. First, I will do respiratory rate. Normal is between 12 and 18 breaths per minute. So to do this, I'll just sit here and watch as she breathes, looking for the chest to rise and count each one. Next, we'll be doing heart rate. For this, I will find the radial pulse, and I will hold for 30 seconds and counting each beat. And normal is between 60 to 100. And then finally going into blood pressure, the normal range is 120/80. So So for her blood pressure was 118/78. So now I'll be assessing lung auscultations. With this, I'll just be using the stethoscope and listening for normal lung breathing patterns. I'm gonna have you breathe in. Out. Again. All right, and I'll have you spin around for me. And with those, I'm looking for abnormal breathing. I don't want to hear any like stridor or wheezing going on, or any other abnormal breathing patterns. So now I'll be doing the rib compression test. This is going to be for possible rib fractures, as well as any other damage like the inside of the abdominal and under the rib cage region. So for this, I'll just be applying a compression force in the rib cage and going down and asking the patient if that causes any pain. Is there a specific location of pain? So pain is a positive indication of this test. So for this test, I'll be doing the AdSense test. With this, I'll have the patient sitting nice, good posture. I'm then gonna find the radial pulse, and I'm gonna bring her into 30-degree abduction. Still holding the pulse. All right, now I'm gonna ask them to laterally rotate your head towards me and look up at the ceiling. And I'm looking for a diminished pulse, which is a positive sign or a reoccurrence of the signs and symptoms that she had been having. All right, so now I'll be doing the Wright's test and the hyperabduction test. So both of these are testing for thoracic outlet syndrome. First, gonna have my patient sitting, nice posture. I'm gonna find the radial pulse. And from there, I'm gonna have them come in at 90 degrees. So holding, and at this position, I'm gonna be assessing the right, so looking for any diminished pulse. And then from here, I'm going to extend up into hyperabduction. And from there, you're also checking to see for a diminished pulse.